Thank you to the Wolfeboro Lions Club for underwriting nutritional wisdom. The Wolfeboro Lions Club is committed to helping the community with health concerns such as diabetes prevention and preservation of sight and hearing. The Wolfeboro Lions Club meets on the second and fourth Tuesday of the month in the 1812 room at the Wolfeboro Inn. Members of the community are encouraged to attend meetings or visit the website e-clubhouse.org/sites/Wolfeboro for more information.
Hi, this is Patty Walker, registered dietitian and certified diabetes educator, welcoming you to another edition of Nutritional Wisdom. In my last show, I interviewed Dr. Cynthia Lawrence, an optician from Laconia Eye and Laser, and she gave us wonderful information on diabetes and eye health. And this show, I decided to step back a little bit and actually explain why diabetes is now an epidemic in our country, what we can do to stop it, and actually why I care so much about doing this, what my passion about diabetes is. See, in 2001, my dad and I drove cross country from Boston to Seattle. It was always a bucket list item for me, but for my dad, he didn't have a choice on his mode of transportation. You see, my dad was obese, he had type 2 diabetes, but he also had some complications of diabetes. He had very poor circulation in his legs and feet, and he also had neuropathy in his feet. He would tell me it was like walking on crushed glass. So flying in an airplane caused too much swelling and pressure, and so he couldn't fly anymore. But he very much wanted to go to a family reunion, so I happily accompanied him on the car ride for 10 days going out west. It was the first time I truly understood that having diabetes not only affects the person with diabetes, but everyone who loves that person. You see, we saw many wonderful things on that trip, but I also remember the things that my dad was unable to see. My dad loved wildlife, but he couldn't walk down the rocky path to see the elk, and he couldn't go 500 feet to see the bear in the ravine. So he had to wait for me to get back and tell him what I saw and to show him the pictures after they were developed. And the other thing that really, really was remarkable on that trip was what I missed. And that was my dad's silent heart attack. See, at that point, I was a dietitian. I was not a specialist in diabetes education and didn't really understand the symptoms. But in fact, he really didn't have symptoms. His symptoms were fatigue and shortness of breath. And when he got back and we realized that he had a heart attack on the time that the silent heart attack on the time that we were together, I could easily remember exactly when it happened. And it happened when we were in Yellowstone National Park, and he tossed and turned all night. He was up, he was labored breathing, and when it was time to check out, he was unable to wheel his suitcase down the hall. From that point on in the trip, I actually had to do all the driving because he was so fatigued. And he was very frustrated and he was embarrassed. He said, why should my youngest daughter have to take care of me? He says, this is not fair. And it's like, I had no issues with it, but he didn't like it. But he also knew that he wasn't feeling well. So he asked me a very, very unusual question. He asked me how he caught all his diseases. And that certainly threw me off guard because you don't catch diseases. I mean, diabetes isn't like pneumonia or a cold. But he actually thought, because he was on his medications, and his medications were multiple, he had 3 for diabetes, he had blood pressure medication, he had cholesterol medication, and many more. His numbers were all good. He would go to his doctor 3 to 4 times a year, and the doctor would say, good numbers on cholesterol, your blood pressure is good, and your diabetes, your fasting blood sugars are good. So my dad honestly thought the medication cured his diseases and did not understand why he wasn't feeling well and why his health continued to decline. So I explained to him how lifestyle and his choices did affect his risk for developing the disease, And he was a little put off. He was a little angry, and he said, well, why didn't my doctor tell me this? And I am confident his doctor did. But when you think about your doctor's appointment, if it's a follow-up, you might get 5-10 minutes with your doctor. And if it's an annual physical, if you're lucky, you might get 15 minutes with your doctor. Neither of those situations are adequate for a doctor and a patient to sit down, review lifestyle habits, set up some achievable goals, set up some motivation and support that's necessary for these lifestyle changes to happen. So, the visit to the doctor was more about, let's check your medication, let's check your blood work, and how are you feeling? So when my dad did return from the cross-country trip, he went to his doctor. That's when it was indeed found that he had a silent heart attack. But it was also discovered that he had one artery feeding his heart. All the other arteries were either blocked or had clots in them. So the circulation is called collateral circulation, was providing, it's kind of like tributaries off a river, was providing the blood supply to his heart. But no wonder he was exhausted. No wonder he was out of breath. I mean, he had very limited heart capacity. The doctor also told him he would not operate on him. And the reason was that he was too high of a surgical risk with all of his now complications, which my dad thought were all treated and cured, were now complications, and he was unable to have surgery that could have saved his life. The doctor encouraged him to lose weight, and my dad did. He lost over 50 pounds, yet it didn't stop the fatal heart attack 9 months later. So on my dad's death certificate, it says myocardial infarction, which is a heart attack, but I know that he died of diabetes. You see, diabetes right now is the 7th leading cause of death in our country, and I am convinced it's much higher. Because other conditions higher than that, so heart attacks is number 1, stroke number 5, Alzheimer's number 6, all have an increased occurrence if you have diabetes. In addition, blindness, non-accident amputations of your limbs, and kidney disease are higher if you have diabetes. So diabetes can kill. Diabetes takes away your quality of life every day if you leave it unattended. So taking serious control if you have diabetes is super, super important. But even more important is type 2 diabetes, and that's what we're going to focus on, is a lifestyle condition. It's preventable in many cases, and that's where I'd like the focus of the show today to be. So we are going to do something a little different. I have some slides that will be up along with me. So I'll have some slides on half the screen, and I'll be talking in the other, so that you can get some visuals to understand the things I'm talking about. So right now, it's time to get serious about diabetes. So, all right. Now you can see we're going back to 2000, the year 2000, September 2000. So about the same time my dad and I went cross-country, you're going to see the front cover of Time magazine. 16 million people have diabetes. Are you one of them? So they recognized that diabetes was getting out of control in 2000. And over the next 10 years, other publications would highlight it in their magazines. Obesity, diabetes. Yet we learned nothing because the epidemic continued to occur. Currently, 30 million Americans have type 2 diabetes. 30 million. So if you go back to 2000, it was 16. Now, I am 100% convinced that by 2020, which is 20 years from 2000, it will double. It'll be over 32 million. And why do I know this? Because the CDC, the Centers of Disease Control, has already predicted that diabetes will exceed 55 million by 2030. That is more than 4,000 people a day getting diagnosed with type 2 diabetes. That to me, I mean, the CDC says it's epidemic. I say it's a pandemic. And a pandemic is an epidemic that spreads worldwide at a rate higher than anticipated. And right now, over 422 million persons worldwide have type 2 or have diabetes. I keep saying type 1, type 2. The majority of cases, over 90% of the cases, are type 2. So that's what we're focusing on today. But let's get back to the United States. Diabetes has more than physical and emotional costs. It also has a financial burden. Because if you have diabetes, your healthcare costs go up. You have to spend 2.3 times more than a person without diabetes. Right now, that averages $10,000 extra dollars a year. Now, there are some people out there that have type 2 diabetes and don't know it. They also have increased health burdens of almost $5,000 a year. And even if you have pre-diabetes, which is a condition we're going to talk about in a moment, your health care costs are $500 more a year than a person without diabetes. So 1 in 7 of our health care dollars currently go to diabetes and its complications. Realize that this one condition, this one health condition, has the ability to bankrupt all federally funded medical plans as we know it in a very short order. So we need to stop it. We need to do something about it. So what can we do? My suggestion is focus on prevention. At the beginning, I had mentioned that type 2 diabetes is a lifestyle condition and it is preventable. This is so important because we know what to do to prevent it. So currently 84 million Americans have prediabetes. That is 1 in 3 American adults have prediabetes. That is, that's very high. And it just doesn't happen overnight. Diabetes doesn't happen overnight. Prediabetes is kind of the warning. It's the red flag. It's the time to do something. So the average person will have prediabetes for 5 to 10 years before type 2 diabetes occurs. So there is time to make choices and to do something. But unfortunately, we're still not taking prediabetes seriously enough. It is very common for me to have clients come in with newly diagnosed diabetes, and I'll ask, what's your history? Did the doctor ever tell you that you had prediabetes? And I get answers like, well, they told me I had provincial diabetes. What's provincial diabetes? Or that my blood sugars were a little too high, or that I needed to lose weight. So one client who went to Dunkin' Donuts on a daily basis switched from donuts to bagels, and thinking he's doing a good job because donuts are sweeter than bagels. But he never understood the role of carbohydrates in the diet and how they affect blood sugars. So he actually increased his risk of developing type 2 diabetes earlier because of that switch. So what I'd like to do now is explain to you what happens with blood sugar control and how diabetes occurs. So we need to look at carbohydrates. Carbohydrates are foods that when we eat carbohydrates, it turns to glucose. Carbohydrates are not bad. Carbohydrates are actually essential for our health. They provide many, many vitamins and minerals and fiber. But you have to understand that all types of carbohydrates, when we eat them, will eventually become glucose. So this is all of your grains, your cereals, your breads, your pasta, your yogurt, your milk, all fruits. That includes dry fruit, juices, canned fruits, and fresh fruit. All fruits have carbohydrate. It also includes legumes. It includes some starchy vegetables like corn, peas, potato, and winter squash. And then obviously anything sweet and snacky. All sugar is carbohydrate, all starch is carbohydrate. But again, carbohydrate is not the enemy. and carbohydrate is not bad. So in a real world, in the ideal world actually, when we eat carbohydrates, they go into the stomach, they get into the intestinal tract will convert it to glucose. Glucose then gets into the bloodstream, and this is where the pancreas comes in. The pancreas secretes a hormone called insulin, and insulin's job is to get the blood sugars back to normal. So insulin is kind of, I think of insulin like the key that unlocks the cell door. So insulin, and insulin is essential. Persons with type 1 diabetes, that's the autoimmune type of diabetes, they have to give themselves insulin injections in order to live. So insulin is important for blood sugar control. So normal blood sugars are 70 to 99. And when I think about insulin, I think about it, I make an analogy like a kitchen faucet. So in between meals and while you're sleeping, your pancreas will secrete insulin into your bloodstream. The reason for that is because other things besides food affect your blood sugars. Things like stress, illness, infection will increase your blood sugars, and exercise decreases blood sugars. So in between meals and while you're sleeping, think of the pancreas put on the drip mode of a faucet. Just drip, drip, drip. A little bit more if you have stress or illness, a little bit less if you just exercise. But the reason that happens is the pancreas is still trying to maintain normal blood sugar levels, that 70 to 99 range. And then when you have a meal with carbohydrates, doesn't matter what type of carbohydrates, maybe you had some bran flakes, milk and a banana, or maybe you had a sandwich with bread, or a potato at supper. Carbohydrates turn to glucose. When the blood sugars go above 100, the pancreas secretes more insulin. So think about the faucet being wide open. So I actually brought a water bottle to show this this a little bit better for you. All right, so I brought an example of a water bottle to be the kitchen faucet. So in between meals and while you're sleeping, your pancreas would be producing a little bit of insulin into your bloodstream just to keep the levels normal. It's a drip, drip, drip. And that's going to keep your blood sugars between 70 and 99. When you eat foods with carbohydrates, it could be your cereal at breakfast, it could be bread at lunch, a potato at supper, or pasta, your blood sugars will go over 100. When that happens, the faucet of the pancreas goes wide open. So the pancreas would secrete a lot of insulin into the bloodstream until the blood sugars go back under 100, and then it goes back to drip, drip, drip. Okay? So hopefully that kind of shows a good visual. Let's look at what prediabetes is now. Prediabetes, you eat the carbohydrates, your blood sugar goes up, the glucose goes up, insulin production's working great. That's all working fabulously. The problem is that you'll see on the picture that if insulin is the key that unlocks the cell doors, some of the cells don't let insulin open up. And the reason is it's called insulin resistance. And this is where lifestyle habits cause insulin resistance. There are many things that are in your control that can reverse insulin resistance. But if the cells can't unlock the door, then the blood sugars start rising up. And if the sugar can't get into the cells, insulin keeps producing more, the pancreas keeps producing insulin more and more and more. So you have a moderate level of glucose, a high level of insulin, but the blood sugars still aren't getting under 100. Over time, the cells that make that insulin can't keep up with that chronic 24-hour demand, so it starts producing less insulin. So it would look like this. Now in prediabetes, again, the fasting blood sugar is the last to rise, so you may wake up And the pancreas is just on that drip, drip, drip mode. Your blood sugars are under 100, and that's okay. And then you eat your breakfast. And the blood sugars go above 100, so the pancreas secretes insulin. And because not all the cells are using the insulin, the blood sugars don't go below 100. So now, between breakfast and lunch, the blood sugars are above 100. You eat lunch, blood sugars go up again. You eat supper, blood sugars go up again. So what happens eventually, and I'm just going to stop for a minute, what happens eventually is the cells that make the insulin stop producing the insulin. If they're forced to work 24/7 for extended periods of time, what happens is the flow of the insulin starts getting less and less and less, and blood sugars continue to increase until type 2 diabetes is diagnosed. So I hope that made sense. It's a simple way of just kind of explaining how the pancreas and blood sugars work together. When the average person gets diagnosed with type 2 diabetes, they've already lost 50% of their ability to produce insulin. So we need to do something to prevent this from happening. So the next slide you're going to see is a slide that kind of shows you how prediabetes becomes diabetes. And the first thing you're going to see on the left-hand side is insulin resistance. That's kind of halfway up the slide on the left. That's the beginning underlying cause of prediabetes. And then you'll see above it, you have a lot of insulin being produced. On the bottom, eventually, you'll see a little line starting to increase. That's your after-meal blood sugars. They go high first. And then the very bottom line is your fasting blood sugar. That takes the longest to get elevated. So the fasting blood sugar is not the best predictor for early prediabetes. It's actually your after-meal blood sugar. Okay? The other thing I want you to look at is, it takes 5 to 10 years before diabetes happens. They also have something called macrovascular and microvascular on the bottom. Macrovascular means large vessels. So you are at increased risk for heart attacks and stroke in prediabetes. Microvascular is small blood vessels. You're also at risk for blurred vision. We talked about that at the last show. That could be a sign of diabetes. Of numbing and tingling in your hands and feet. Of erectile dysfunction. These are all potential signs of diabetes, and the risk happens in prediabetes. So blood sugar control is so important. So what do? We need to be proactive. Proactive means understanding what the symptoms of diabetes are, knowing the risk factors, getting tested, and taking it seriously. So, what are the symptoms of diabetes? The most common symptoms would be fatigue, increased thirst, and increased urination. You notice you have to get out of bed 3-4 times a night now. Actually, that's not normal. A lot of people think it is because they're on diuretics or medication that increase their need to use the bathroom. But also recognize that fatigue, increased thirst, increased urination are the most common symptoms of elevated blood sugars. And I'm going to tell you, over half the people that have diabetes reported no symptoms. So these are important that you have to understand how your body is reacting and get in touch with your body. Okay, other things. Hunger is a sign of diabetes. Wounds that don't heal well because the blood flow doesn't get there is a sign of diabetes. So if you have a cut that takes longer to heal than usual, just be aware of that. Blurred vision, we talked about that. Erectile dysfunction and vaginal yeast infections are all signs of potentially high blood sugars. Okay. There's also another one on that chart that says rapid weight loss. I tend to find that happens more in really uncontrolled diabetes. This is a person that's had diabetes for a while and just didn't know it. And then all of a sudden they start losing weight, and I've had clients say, hey, I liked that side effect, but it's not a good side effect because it's if you're losing rapid weight with type 2 diabetes, chances are you're developing some complications of diabetes because your blood sugars are too high. So those are some of the symptoms. So what are the risk factors? Right now, most of us will not be tested for diabetes until over the age of 45. Those are the standards. Test at age 45. If normal, wait 3 years, retest, and if you have prediabetes, they'll test annually. So I'm going to disagree with that recommendation because I think that if 1 in 3 Americans have it, we are now diagnosing diabetes and prediabetes in teenagers, in youth. So the more risk factors you have, the greater chance that you are going to develop prediabetes. So what are the risk factors? Weight, activity, and diet are the big ones. So if you eat a diet high in fat and processed sugar, you have an increased risk. If you're overweight or obese, you have an increased risk, and if you're not active. But there are other things that have risk factors. So if you have high blood pressure, if you have high cholesterol, you have an increased risk. If you have a family history, siblings or parents that have type 2 diabetes, that unfortunately does increase your risk. But please know that it only affects your risk by less than 10%. We now know that your lifestyle choices can actually turn on and off genes that affect your risk for getting chronic diseases. It's called epigenetics. It's a very exciting field, but just because your parents and your siblings have diabetes doesn't mean you will. As I'd mentioned, my dad had type 2 diabetes. I am one of 5 siblings. My siblings and I, none of us have type 2 diabetes because we did make some lifestyle changes and we took it seriously. There are some medications that can increase your blood sugars. Those would be prednisone and statins. Statins actually can cause a subtle, but an increase in blood sugar, so every little bit counts. And then ethnic populations. The 3 biggest ethnic populations that are at increased risk for type 2 diabetes are African American, Asian American, and American Indian. So look at the risk factors. You can go online on my website or on the CDC website and take a prediabetes screening test to determine your risk, but ask to get tested. So we've gone over the symptoms, we've gone over the risk factors. So what test is best for diagnosing diabetes or prediabetes? The most common one is the A1C. It's a very convenient test because you don't have to fast for it. You can have it done late in the afternoon for your physical, and it gives us the percentage of sugar that's been in your bloodstream for the last 3 months. It gives us kind of a look back as to how your blood sugar control has been. Unfortunately, as I'd mentioned before, other things affect blood sugars besides your risk of diabetes. So it's not the perfect test. So if you do have the A1, it's where I'd start. And if your A1C comes back in an abnormal range, so you're going to see the chart there. Normal ranges are between 4 and 5.6%, 5.7 to 6.4%. Again, this is the percentage of sugar that's in your bloodstream. Would be prediabetes, and 6.5 and above is diabetes. So if you have a pre-diabetic range or a diabetic range without symptoms, I would recommend a follow-up test of a fasting blood sugar. Again, that's the last one to rise. And if you want an even more accurate test, it's a 2-hour glucose tolerance test that your doctor can order, and that's going to give you the quickest results as far as how, what your risk for diabetes or prediabetes is. So those are different tests. And sometimes, I mean, they have glucometers that you can buy over the counter, and that's kind of like a snapshot in time of your blood sugar control. So the A1C measures a 3-month, it's kind of like the movie picture of the past 3 months, and it's an average, and a finger stick is just a moment in time. It can, however, give you good information. So I actually am very excited to announce that I am working with the local Lions Club, and we're actually going to have a blood sugar and a vision screening, health screening for both of those on May 14th from 9 a.m. to 12:30 at St. Cecilia's Church in Alton. It is open to the public, it is free of charge, and it's an opportunity for you to, find out what your blood sugar is. The best values or the best time to have your blood sugar checked would be fasting, which means you haven't eaten for 8 hours, or wait 2 hours after food or beverage, except for water. Water is fine, but that will give you the most information. So we invite you to come on May 14th to get that blood sugar checked. We will not be diagnosing any conditions at that screening. It's merely informational, and we'll give you recommendations for follow-up, because only your doctor is able to diagnose diabetes and prediabetes. So let's say you came to our testing, or you followed up with your doctor and had some blood tests, and it came back in a pre-diabetic range. That is the time to do something. The diabetes prevention program has proven that we can prevent diabetes. And the two most important things are weight loss of 5 to 7% and regular activity of at least 30 minutes 5 days a week. Those are two lifestyle habits that we need to encourage and help and support you for. Let's say it came back in a diabetic range, or you have diabetes. Please take it seriously. This is where you really need to see all medical professionals that will support you. That would include an annual eye exam. It would include an annual comprehensive foot exam. It would include seeing your doctor at least 2 to 4 times a year, seeing a dietitian who's a specialty in diabetes, at least annually and 2 to 3 times the first year, attending classes. These are all important because the person with diabetes is in charge. You make over 1,000 different decisions a day that will affect your control. And we can prevent complications. And that's also the second part of what I'm so passionate about is I don't want you to have complications. Because if you have diabetes, you have a 2 to 4 time increased risk for heart attacks, 2 to 6 time increased risk for strokes. You have a 17 time increased risk for kidney problems, 25 times increased risk for blindness, and a 5 time increased risk for an amputation of a foot or a lower limb than persons without diabetes. Complications, the symptoms of them are silent many times, and once they happen, we can't turn back the clock. So we need to really be proactive and help you get the help you need. Okay, so again, there's one more A1C chart there. It kind of looks like a thermometer, and what that shows is the danger range, because A1Cs above 7% have an increased risk of long-term complications. That A1C test actually measures your risk for long-term complications. And every point above 7% you have a 37% increased risk for complications. So we want to prevent that. So my dad was certainly my inspiration to become a certified diabetes educator. I have a passion to help you prevent diabetes and prevent the long-term complications of diabetes. and it would be my pleasure to help and support you. So I hope you've learned something from what we've talked about today, and please reach out if there's anything I can do to help. And finally, I'd like to end on a recipe. I thought long and hard about this recipe. I like simple recipes, but I don't know if many of you know that eating a serving of leafy green vegetables a day can reduce your risk of developing diabetes. So, and also beans. Eating a serving of beans a day can reduce your risk, but this one is a spinach strawberry pecan salad. I've modified it to be healthy. So you'll see the recipe on the side. What you want is a container of baby spinach. You can do a 12 ounces. You can do 16 ounces. Quarter strawberries. You just want to quarter or slice them however you like them. It's going to be a nice contrast, and strawberry season's coming right up, so that's going to be a delicious complement. You can go to the farmers markets, or there's a great farm that sells strawberries in Wolfeboro, so Half Moon Farm. So consider supporting Kevin and Jen French and get your strawberries locally. And for the roasted pecans, get the raw pecans. That means without any oil or heated. And you can get the pieces or you can get the whole ones. And to roast them, all you do is heat up a skillet on the stove and put the pecans in and toss them until they're aromatic, until they're fragrant. You want to be careful not to burn them, so you want to be mindful and continually tossing them. But you'll start smelling the oils in the pecans. You don't need to add any extra oil to roast them, because the pecans actually have oil. And then you have the recipe for the balsamic vinaigrette dressing. You have a half a cup of olive oil. In all honesty, I usually do a 1-to-1 ratio of olive oil and vinegar, so you could do a third of a cup or a quarter of a cup if you wanted to, because I tend to like vinegar. Quarter of a cup of balsamic vinegar, and then 4 teaspoons of Dijon mustard. Whisk it up, and at the time of serving, just drizzle the dressing on the salad and enjoy. Thank you so much for watching, and feel free to reach out to me if you have any questions or concerns. Have a good day.